It is estimated that more than 45 million Americans have at least one tattoo. Experts say that 50% of these people will want at least one of them removed at some point. So don't feel bad if you've decided that you've outgrown a tattoo that you got on spring break years ago, because you're not alone. You are just one of 22 million Americans who are searching for a way to comfortably remove a tattoo. And today we have the opportunity to interview one of the most esteemed plastic and reconstructive surgeons in the field about a revolutionary laser tattoo removal procedure.
That's right. That was a mouthful. But Dr. Stephen Mulholland is a world-renowned expert in aesthetic laser procedures and cosmetic surgery. He joins us today to talk about the new laser from Cynosure that uses laser technology to effectively remove tattoos and other brown spots and brown discolorations. It's called the RevLite, and we're really excited to talk about it. Thank you, and welcome to Aesthetic TV.
Thank you, Brenda. Dr. Arden.
Thank you so much, Dr. Mulholland, for being here. And can you tell us a little bit more about the RevLite laser system?
Absolutely. You know, the RevLite really represents the zenith or culmination in tattoo lasers. So the RevLite, what the engineers have done, they've really pioneered and engineered the optimal laser. It emits little bundles of light, but you need little bundles of light that will treat all the different colors, not just blacks and greens anymore.
Right.
And so these bundles of light go down onto the skin. They go after the color specifically that bundle of light is made for. The engineers have also created the kind of durations of exposure or the length of time on skin that we need to effectively treat. And what happens, it's not, patients are worried about a laser burning them. It doesn't even work that way. It's an acoustic sound wave, basically a shock wave that shatters the pigment in a very brief period of time. So the RevLite is really, you know, it's like the Ferrari now of tattoo removal devices.
Oh, I love that, the Ferrari of tattoo removal devices. That's great. And other colors take longer to treat than others, is that true?
Yeah, so in greens and blacks we do well with. Once you start layering in yellows and robin's egg blues and reds, that's where we've traditionally had a lot of trouble, and the RevLite has allowed us to now effectively treat those.
Wow.
Big innovation.
It really, really is. So Dr. Mulholland, I'm a little curious, what is your patient? What does that patient look like? And what is the most common reason that somebody walks into your office and says, hey, you know, I need a tattoo or a pigment removed? And is there a typical patient for this type of treatment?
Yeah, there sure is. Usually between 18 and 30, we're accumulating all the things we don't want: wrinkles, heartbreak, relationships, and tattoos.
Right.
So women and men between 30 and 50, that's when they're removing them.
Right, 30 and 50.
That's 30 and 50. And generally they have the economic means and wherewithal to be able to afford it.
Right.
And they've had time to think about the meaning of that tattoo and the relationship between them and their skin. So they usually come for a series of treatments between 8 and 15.
Okay.
Depending on
That's so important for viewers, for prospective patients to understand. And I know you've brought some before and after photos with you. Why don't we take a look and run through those?
It's a good idea. So the first one that you see on the screen now represents what I would call modern black and green. It's dark, it's deep, it's not in the superficial part of the skin, it's quite deep. And again, the RevLite gives us the type of profile of that laser light, allow us to remove that effectively. And you can see usually about 90 to 95% of the colors removed. We don't have the same white shadowing left behind like we used to.
The ghost.
Yeah, the ghost. We don't get the ghosting anymore. And so that would be what I would call a modern, tricky black and green tattoo. Now, if we advance to the next picture, now we add color.
Yeah, that gets tougher, right?
That's the problem, but the RevLite can do it.
Yeah, so we've got the orange beak of the bird, we've got some dark and light green, some blue, and some black. And again, with the RevLite, we simply switch from a bundle of light A for the yellow to the bundle of light B for the green, and sequentially during the treatment, each treatment attack each color, and each time they'll see incremental fading.
It's very specific.
Correct. And so you can see even with a multicolor tattoo, very little shadowing or ghosting, very little evidence that you ever had anything there, no scarring, no textural changes in the skin. That's how far we've advanced.
It's a fabulous result.
Now, red. Red has always been tricky.
Right.
It really has been. And so we'd often have the outline of the Rolling Stone tattoos. The black's gone, but you still have a tongue sticking out at you.
Right.
So with the RevLite, again, we just dial in those bundles of light for red, and we can start whittling away at the red color.
Right.
And you can see even with a difficult, rose, the thorn of the rose may still be there, which is the old relationship, but the flower and the bloom is gone. The last one represents the king of all tattoos. Every virtual color known to a tattoo artist is in this serpent around this, this dagger. You've got blue, you've got yellow, you've got red and green. And again, the RevLite allows us every single treatment to sequentially target all components of that multicolor tattoo. And after, this would be one of those 12 to 15 treatments.
Right, that's big. That's a really large tattoo.
And an impressive result.
So the size of the tattoo matters at the length of the procedure.
Correct. And the cost. And
the cost. And
smaller tattoos cost less than bigger tattoos.
Right, and to have an effective result. But I have a question for you as we were looking through the photos, which you have amazing work. The RevLite obviously works. It is phenomenal. Does it make a difference if your tattoo has been on for 5 years or 40 years at how difficult it is to remove it?
It absolutely does. Now, the ones that are 40 years ago are usually a breeze because they weren't strong inks.
Okay.
There weren't the multicolored options. And they're usually those Korean War veteran type tattoos or old gang tattoos. They usually come off easily. The more modern ones are deep and brilliant colors and really strong ink. And they're more difficult to remove.
Right, but I mean, if somebody's had a more modern tattoo, but they've had it on for 20 years, and somebody walks in and they've had the same tattoo on for 10 years, is there a difference in the length of time of treatment?
If it hasn't been, it depends on the dye, is that your question? If the dye is faded somewhat while it's been living in your skin, it's easier to remove.
That's what I was wondering, if the dye makes a difference. That's so interesting.
The RevLite's very versatile as well.
Right.
You know, a lot of women don't have tattoos, but they're really bothered by brown discoloration.
Yes.
Sun exposure in Southern California, which you're very familiar with, or in Las Vegas, or in any climate. So brown discoloration has been very difficult. Women after babies or birth control. Good for that pregnancy mask.
And that has been really tough.
Very difficult, especially for darker skin types, Asian or Hispanic patients with brown discoloration. You're afraid to remove their own pigment, let alone the discoloration pigment. Again, the RevLite with unique settings for these bundles of light allow us to the first time to really treat brown discoloration age spots. 80% of all Americans have unwanted brown spots. And those are ones you can see, and the ones you can't see, virtually 100% of women over 70 can find a brown spot they don't like.
Well, I'm not 70 and I definitely have a few, but you can treat the brown spot but not have to treat the whole skin and the color will be the same? How does that work?
The really neat thing about the RevLite is, again, if it's versatile for patients. If they don't have a tattoo but they suffer from brown discoloration, that normal lasers like photo rejuvenation, photofacial, typical lasers have been out there for a while. They don't get rid of that. The RevLite has that, remember, the ability to control the duration of exposure to that light. And formerly difficult things to treat, the RevLite can work on very nicely.
I mean, I need your number. This is phenomenal.
When you're old enough.
For a little, we can. Can you hook me up?
I can get that done for you.
When you're old enough. When you're old enough.
Okay. Thank you for sharing that with us. Really, it's so amazing. And those before and after, it's so effective. The RevLite really is. Maybe just walk us through, you know, what a patient would experience when they walk through your doors. They walk in your doors. What happens? Does it hurt?
Well, first, a proper consultation with a certified physician who's trained in these types of techniques would be important. Let's say you've got the consultation and the consent, and then it comes down to treatments. They come in, and it's really done quite simply now. A little topical anesthetic cream. We have very good, strong topical anesthetic creams now. Cooling devices to keep the skin cool. And that's really obviated the need in most cases for any kind of freezing. No freezing, no needles. So a lot of viewers and patients thinking, oh, I don't want to get a needle. You don't need to. And so the treatment usually takes between 15 minutes and 45 minutes, depending on the size. Patients will, they'll hear a snap, snap, snapping, and the dull feeling of an elastic band hitting their skin, but their skin's numb, so they feel the pressure. And what they're hearing when they hear the snap, snap, snap is not it's not a heating effect. They're afraid, oh, you're going to burn my laser.
Yeah, smell burning flesh.
It's not how we do it. No. The laser actually works through a unique mechanism called photoacoustic, which is a fancy way of saying sound waves shatter the pigment. And when you've shattered the pigment, some will fall off in the crust over that first week, and your immune system actually gobbles up your tattoo for several weeks after.
So much more sophisticated than when we first started.
When we first started, we used to use these ablative techniques that were horrible. It's really refined now. And so the patient will have a little dressing and some antibiotic ointment. They'll wear that for about a week and then take it off. Most of the initial color pigment will come off with a bandage. And then we usually do a treatment every 8 to 12 weeks because the immune system and skin needs to recover from the treatment and get ready for the next treatment. So we can assess okay, this much pigment's gone, and we can adjust our energies.
So when you take care of patients, you know, they want to see, we're instant society, you know, I want to do it and I want to do it now. I want to see this. I know you said typically around 8 weeks for results. Is there anything other than, you know, they peel off the bandage and they see some results then? Maybe give us a typical run through of when they can expect to see a
It's a
good
good
result.
point, because it's very important for tattoo doctors with the RevLite to counsel the patient. This isn't like Botox or soft tissue filler where bang, you look great in a few hours or a few days.
Right. So they need to stay committed as well to the process.
They see it going away, but it's fairly slow and gradual. We want to take the pigment away, but leave the pigment of the skin intact so it doesn't look odd or ghosted, which is leaving a white spot behind. And so generally, the first 3 treatments, you'll often see 30% improvement, and patients see, but after that, it's about 5 to 8% improvement each treatment thereafter.
So it's a slower process. It's not as visibly, you know.
It's not the big wow after the first 3 treatments, but we gradually keep going after the residual colors and pigment. Sometimes let's say the blacks and the greens are gone first, and we're still hitting the yellows and the blues, and then the light oranges. But eventually, with the RevLite, we can be successful.
Yeah, it's just important to know all of that going into it, and then you're ready to go. Well,
that's right.
Thank you so much.
Thank you for having me on, Dr.
We really had
thank you.
An expert plastic surgeon who really knows his stuff when it comes to this area. And if you're interested in trying out the RevLite procedure for yourself, use the physician finder on aesthetichtv.com to locate a doctor in your neck of the woods. Thanks for watching today, and stay tuned and stay beautiful with Aesthetic TV.